I want to begin to say thank you first to our host, Christine Schneider, member of the European Parliament, a member of Envy and Agri committees, and chair of our SME Connect Working Group Health and Nutrition. Thank you that you take your time to support us so often and so much with these important topics. And I want to say also in the beginning, thank you to our cooperation partner, the European Association for the Studies of Obesity. Thank you very much. I think it's the starting point perhaps for a longer cooperation. It's a very important topic for our SMEs and also for their employees. And also as a business case, of course, this is also if we're discussing this important issue. And now I pass over to Christine Schneider for the welcome and opening. Please, the floor is yours.
Thank you so much, Mr. Heinz. Good morning to everyone. It's a pleasure to welcome you all to this webinar on the influence of nutrition and physical activity on overweight and obesity. As a member of the Envy Committee and the rapporteur of the EPP on the Farm to Fork strategy, on the focus of my work lies on the question around healthy and sustainable food and nutrition. I'm very happy to discuss with you today the challenges regarding the influence of nutrition to our health. Obesity is a major risk factor for several of today's most serious health conditions and chronic disease. Obesity is generally caused by eating too much and moving too little. Obesity does not happen overnight. It develops gradually over time as a result of poor nutrition and lifestyle choices, such as eating large amounts of processed or fast food that's high in fat and sugar, drinking too much alcohol. Alcohol contains a lot of calories, and people who drink heavily are often overweight. Eating out a lot, even if we are unable to eat out at this moment, this should not be left out. You may be tempted to also have a starter or dessert in a restaurant, and the food can be higher in fat and sugar. Eating larger portions than you need. You may be encouraged to eat too much if your friends or relatives are also eating large portions. Drinking too much sugar drinks, including soft drinks and fruit juice. Comfort eating, if you have low self-esteem or feel depressed, you may eat to make yourself feel better. Unhealthy eating habits tend to run in our societies. You may learn bad eating habits from your parents when you are young, and you continue them into adulthood. And there is the lack of physical activity. The lack of physical activity is another important factor related to obesity. Many people, look at us, have jobs that involve sitting at a desk in front of a computer for most of the day. And many people also rely on their chairs rather than walking or cycling. For relaxation, many people tend to watch TV, browse in the internet, or play computer games, and rarely take regular exercise. If you consume high amounts of energy, particularly fat or sugar, but you do not burn off the energy through exercise and physical activities, much of the surplus energy will be stored by the body as fat. Overweight and obesity are influenced by a combination of factors which usually results in consuming more calories than the body needs. Good nutrition, physical activities, and a healthy body weight are essential parts of a person's overall health and well-being. Together, this can help decrease a person's risk of developing serious health conditions such as high blood pressure, high cholesterol, diabetes, heart disease, stroke, and cancer. A healthful diet, regular physical activity, and achieving and maintaining a healthy weight also are paramount to managing health conditions so they do not worsen over time. These factors may include diet, genes, lifestyle, socioeconomic background, and as well physical inactivity. The health impact of nutrition and being physically active cannot be understated. There are many possibilities to prevent overweight and obesity. Breastfeeding, feed growing children, appropriate portion sizes, build early relationship with healthy food, eating healthy food in a family, encourage eating slowly and only when hungry, limit unhealthy foods in the household, incorporate physical activities, consume less bad fat or more good fat, consume less processed and sugary foods, eat more serving of vegetable and fruits. As you are aware, I do not support of bans as no on also no on food. I believe in education and role models. We all should be role models when it comes to healthy nutrition. Healthy eating, education can include it with education, nutrition mentorships, teaching kids or cooking classes, supermarkets or on farm tours, the destruction of receipt pamphlets or menu calendars, nutrition classes to address specific healthy conditions, and as well individual nutrition counseling. There are many possibilities to fight overweight and obesity, and also a political. I am committed to work for better nutrition and activity models to fight overweight and obesity. I'm looking forward to an interesting discussion. Thank you for your attention.
Thank you, Ms. Schneider. I think you gave us a perfect overview of the problematic. I think at least me, I'm touched because some of these advices are also I'm breaking several times. But I would say at least in the alcohol case, wine, we should accept it should be healthy for heart. But no, I think it's very important what you say, and I think also your political message we have to discuss then also during during this webinar is of course what can help us out of this pandemic and kind of pandemic, education bans or not, and how we can empower consumers to make the right choices. And we're coming directly to the first speaker of the debate from the European Commission, Ioana Bacchiogianni, Project Officer of the Joint Research Center, European Commission. Please, the floor is yours.
So good morning, everyone, and thank you very much for the opportunity of being here with you today. As we all know, we are here today to talk about obesity and its prevention. Obesity is considered a chronic disease, and it is, as mentioned before, associated with many comorbidities such as cardiovascular disease, diabetes, and various types of cancer. It is almost 60% of the EU adult population that have been found to have higher body mass index in 2016, while 23% of the EU adult population is affected by obesity. Unfortunately, the data is also concerning for children and adolescents, and what is more is that more than 500,000 deaths annually in the EU are attributed to higher than optimal body mass index. Obesity also costs the EU quite a lot. And this is why all of these reasons are why there are many activities with the two new overarching initiatives in the European Commission, the Europe's Beating Cancer Plan and the Farm to Fork strategy that include many activities which are aiming in the prevention of obesity. Today, and with that opportunity, next slide, please, I would like to talk to you about the projects from the Joint Research Center related to the prevention of obesity. First of all, we have already published our report on the front of pack nutrition labeling, and we're actually right now working on its update of the literature review in order to include the latest data related to the use and implementation of various front of pack labeling scheme in order to inform a harmonized front of pack nutrition and labeling scheme that would allow the consumers to easier make healthier food choices. Next, please. So Moreover, the Joint Research Center has published a marketing toolkit for the food and non-alcoholic beverages marketing for children and adolescents. In light of the update of the Audiovisual Media Services Directive, the JRC published this tool in order to provide practical information and guidance and give an overview of all the aspects and fields that should be covered by the update of their codes of conduct. At the same time, it gives information, advice, and even phrasing examples from other codes in order to facilitate this update and or development. Next slide, please. Then we come to the Health Promotion and Disease Prevention Knowledge Gateway. This is an online portal with reliable, up-to-date information on topics related to public health, health promotion, and the prevention of non-communicable diseases. The topics that are included in this gateway are prioritized and are decided after the input of policymakers and stakeholders across the EU related obviously to health promotion. The goal of this knowledge gateway is to provide understandable, clear information both to experts and non-experts in order to practically have a one-stop shop for all the policymakers in the field of health promotion with all this necessary and appropriate information to make their case and to support the implementation and development of public health policies. Next one would be our best practices portal. This project has been conceived and designed in order to support the transfer and the implementation of evidence-based best practices. What does it mean? It hosts the submission of intervention and practices that are then evaluated by experts in the field in order to select the ones that are going to be best. These ones will be then hosted in focused marketplace workshops where experts, stakeholders, and representatives for the member states can express their interest and probably when for the practices that they will be committed to implement, EU funding will be made available. Actually, right now we have a call open, and up to the 14th of March, we have a call open for practices to prevent obesity and other non-communicable diseases. So we would like to invite you to submit your practices or tell potential best practice owner to submit their practices. And with this, I would like to thank you very much for your attention and looking forward to the rest of the discussion.
Thank you very much. I think this gave us a brief overview of facts and shows us how important this issue is and what the Commission is doing. I think what is very interesting also is if you could tell us a bit more about the aspects that you will take in consideration in your front of pack nutrition labeling review, because this is very practical also for our SMEs. Please.
Okay, thank you very much for this question. So when talking about the front of pack labeling, we have various aspects that we would like to include in this report. And obviously, it all depends on what is available in the literature. Our focus would be on the consumer awareness and the consumer use of this various front of pack labeling scheme, how understandable they are in various groups of diverse socioeconomic levels, of diverse education levels, in order to understand the aspects that can make a difference and make it more understandable in a way. At the same time, we want to see whether all schemes have the same effect in various food products. And then some of the aspects that are not so much covered in the literature, but we would like to find information on, are also the impact on the food industry, the impact on price, etc. And this is probably where, as you said before, the SMEs can even provide information if they have any reports that could be of use for such a report. We can evaluate and then see whether we could use something.
Thank you very much. It's very interesting for us because we have this initiative for a healthy lifestyle at work and home. And SMEs are employing 60% of employees, and we want that, or our SMEs want to empower also to help the employees to become more healthy. It's of course a win-win situation, because then if you have healthy employees, you have also more productive employees. I think this is I think it's always not only it's a health case, but it's even more, I think, for our society. And how we can tackle this, I think we should discuss what is an obesogenic environment. If you see this labeling as one part of this, Professor Hassapidou, how you would describe this? Please, the floor is yours.
I'm so glad to be with you today. Thank you for inviting me. I'm representing the European Association for the Study of Obesity that was established in 1986 and is a federation of professional memberships associations from all over European countries. There are 36 European countries participating, and I'm chairing the nutrition working group. So let me start, since I'm Greek, with what Hippocrates first said: let food be your medicine and medicine be your food. And this is why I'm starting from this, because the relationship between our health, our food, our environment dates back centuries. Hippocrates not only said that to have the food as our medicine, but he also highlighted the need for a harmony between the individual and its environment. So the story goes back many centuries. Now let's try and have, let's try and explain what we mean by obesogenic environment. It actually refers to the influence of all our surroundings, all our opportunities, all the conditions in the environment, all the conditions of life that somehow could promote obesity, not only at an individual level, but at the population level also. I can give you some examples. For example, how can we increase the availability, the accessibility, the affordability of, for example, energy, decrease the availability and the affordability of energy-dense foods? It can be a very good example how we can change the environment in order to tackle the obesity epidemic. Intense marketing is another example, and we can discuss that later on. We all agree that the healthy choices must be the easy choices. And there are, as I said, many environmental factors, not only regarding our food environment, but also regarding green spaces in the environment, walkability, and also density, for example, is another example that I'm thinking now. Unhealthy food outlet relative density is another example. We had a very good project just finished that it was a very good, we found a very good correlation between unhealthy food outlet relative density and BMI, even spaces of social interaction. Therefore, all the studies and the reports, even from the most influential health organization, call on policy and nutritional strategies to change this obesogenic environment in order to fight the obesity epidemic. And all the public health experts suggest that this policy should be carried out at different levels, not only at local level, but at the regional level, at the national level, and at the European level. This is, I would say, my first answer to your question, and then I'll continue later on.
Sorry, I think thank you for this answer, and it shows that it's a multi-level answer in fact, and it means we have to think global to local, and I think this is an approach who makes it very complicated. Can you give us also examples of effective nutritional policies for tackling overweight and obesity? Because you say policy is part of the solution and not only the personal decision. Please.
Yes. What can we do? We have to create a healthy food and drink environment. We have to promote the gains of healthy diet through our lifestyle, through our life course, especially for the most vulnerable groups, to reinforce health systems to promote healthy diets, to support surveillance, monitoring, evaluation, and research, to strengthen governance, alliances, and networks to ensure a healthy in all policy approach. In order to have healthy diets, we have to ensure that healthy food and nutritious food is accessible. I said that before. They are very, very important words, but we have to follow all this procedure: accessible, affordable, attractive, and sustainable. We have to promote the gains of a healthy diet and nutritional support through all our life course, from birth to old age, especially for the most vulnerable groups that we do know that have the biggest problems. Also in clinical settings and in the community, because when we're talking about tackling obesity, we're talking at an individual level, at the clinical settings, and the community. If we want to improve our diet and to prevent obesity, all these policies would aim to decrease the unhealthy food and increase the affordability of healthy foods. And we have to do that in various settings: home, school, workplace, and community. So in order to develop nutrition, let's say food policies, we have to have national public nutrition education. We need to have dietary guidelines. Probably this is the right point to say that as EASO, we're developing new dietary guidelines for obesity, new European dietary guidelines for obesity for children and for adults. We had already about nutrition labeling for food packaging, menu nutrition labeling for food provided in restaurants, regulation of food marketing. We can discuss on economic policies affecting food prices. I'm very much interested on school-focused nutrition policies, and we have some very good examples, and community-based nutrition policies. Let me say a few things just for a few minutes for tackling childhood obesity, which I think we have to pay a lot of emphasis on that. We have to support a healthy start in life. We already heard about breastfeeding. We have to promote healthier environments, especially in schools. We have to make, especially in schools, the healthy option the easier option, by restricting marketing and advertising to children, by inform and empower the families, by encourage children to be more active at school and make something about it. Help the school environment to provide more physical exercise, to monitor and evaluate, and of course, always to increase research. WHO has a program, it's called COSI, Childhood Obesity Surveillance Initiative. My department and myself are responsible for this program in Greece, and we have a lot of important results. I would advise everyone to go and see the latest publications in COSI website. Some of the nutrition strategies, they are proposed for childcare to develop, implement, and evaluate food and beverages policies, to restrict vending machines with soft drinks in primary schools, to install water fountains in schools, distribution of healthy foods, including especially fruits and vegetables, to vulnerable groups, restriction of certain foods and beverages sold in school premises. Catalogs and product catalogs allowed to be sold in canteens. To improve the capacity of childcare providers and food service staffs in nutrition education and healthy meal planning. A lot of countries are paying a lot of attention the last few years on healthy meal planning. Provide parent education to the childcare setting and encourage the parent engagement and involvement in the menu planning, and to support and encourage the healthy eating. Last but not least, we completed a few years ago the JAMPA project, the Joint Action on Nutrition and Physical Activity. That was a European joint action to contribute to halting the rise of overweight and obesity in children. And I'm just going to spend 1 minute to tell you some of the conclusions of this very, very important project. Nutritional policies should be designed to change the context in which the undesired dietary pattern occur. That is the food environment. So the message is we have to work on that. Again, a life course approach is necessary. A multi-sectoral approach is needed. And we should not forget that we have a lot of evidence that nutrition is related to social conditions, and inequalities should be addressed. This is a very important message. Social and political mobilization is needed, and nutritional interventions could not be carried out only by scientists. They require partnerships and require networks. Thank you.
Thank you very much. And I have to jump directly to Ms. Moretti, member of the European Parliament, member of NVM Becker, because she has to leave earlier. And I think she's member of the Special Committee on Beating Cancer. And I think perhaps you can say some words about obesity and cancer in this context. Please, the floor is yours.
Thank you very much, and good morning, everyone. Thank you a lot for this invitation, and thanks to my colleague Christine. If we try to gain a lesson from the last year, we could say that we learned that health is a serious issue. We learned that hard way that is important to invest in the health sector and to prevent. Obesity is recognized as a major public health problem in Europe and the most serious global health challenges of the 21st century. According to the World Health Organization, the adults in the EU who suffer from obesity or are overweight increased from 47% in 1990 to 60% in 2016. Despite this, there is a deep lack of understanding for the causes of obesity, which are complex and multifaceted. Further research is needed to better understand the drivers of overweight and obesity and to explore evidence-based approaches to a healthy diet and a physical activity across the life course. In addition, further public health research is needed to highlight the economic consequences and drivers across all socio-economic groups, as well as to ensure effective public health policies, interventions, and prevention programs. Today, I would like to focus on the childhood obesity. The childhood overweight and obesity is a major health challenge in many member states, which contributes to widening health inequalities, with children as the most vulnerable group most severely affected. Moreover, childhood obesity is a strong predictor of adult obesity, with well-known health and economic consequences, as over 60% of overweight children are likely to become overweight adults. Nearly 1 in 4 adolescents are overweight and obese in Europe. Tackling obesity is not as simple as telling people to exercise more or eat less. No single action is enough to address childhood obesity. Given that in most European countries, children spend close to a third of their daily life within the educational environment, it's important that healthy diets and physical activity are promoted in educational settings and childcare centers in cooperation with parents. School meals offer a good opportunity to support healthy eating habits and promote health. I strongly believe that education can make the difference in every field, also talking about health and nutrition. And education starts from families. That's the reason why we must assure a good information regarding food sector to every citizen. The European Union is now working at a new harmonized labeling system. In fact, the correct consumption of food also depends on the accuracy of the information. If there are errors or deficiencies in the indications, customer could misinterpret the content of the products. I share the idea to harmonize the labeling system in the European Union, but we have to do it in the right way. The crucial point is that the new system should not influence the consumers, but it should inform that instead. It's important to give citizens all the tools to understand how to eat, to be healthy. Food is not good or bad because of an algorithm whose functioning I have doubts about. My mission as a member of the ENVI and BECA committee, but also as a mother, is to work for a European regulation that can empower citizens in order to make them to do the best possible choices regarding their health and their children's health. Thank you very much for this occasion. Good luck.
Thank you very much, Ms. Moretti. I think that you made the focus on children and education is key. I think what we have also discussed that if we're speaking about children from small income, is they have more often this problematic. We see this also with the income of middle income of countries like Mexico or Bulgaria or so on, where we see that this problems is not only a problematic of rich countries, it's also a social dynamic in here we have to discuss. And I think we have also discussed the food labeling to empower the consumers. This is also what we hear now often. But if we discuss now, or we have this focus on the consumers and education, we come also now with Mr. Francisco Guerrero, member of the European Parliament and Vice Chair of Agri Committee, to the producers, to the source, to the agriculture sector, to the food producers. This is the other part of the starting point of this discussion. Please, the floor is yours.
Thank you very much for the invitation. I hope everyone is in perfect health. Well, I disagree with some of the positions that were already stated here, but let me just share my screen so I can state why I disagree. Okay, I think everyone is seeing, so I'll skip this one. So one of the key important things that was said by the moderator is that obviously this starts also by the way we produce food and the way we sell it and the way we market the food. And in that way, we can see that, well, there's a lot of lobbying being made through these several agents that in the end influence consumers to make their choices. And that's why consumers sometimes don't make the best choices because they are driven by marketing, by labeling that it's not correct, by several other marketing aspects that need to be addressed, not only at the European level, but also at the national level. So obviously we have this, all these areas that influence the way we eat and the way our children eat. And so we must address them because they are also very relevant. And we, as politicians, have huge responsibilities in this pandemic that is the overweight of our society. And we know that we are facing several lobbies, and they are really, really strong in our society because, well, this is also a cultural shift, because we know that these areas, for example, the livestock industry and the milk industry are big industries, and they receive a lot of money from the Common Agricultural Policy and benefit from other national and local subsidies. And so obviously when there's a science-based approach that says that, for example, we do need to reduce the consumption of processed meats or certain types of meats or even dairy products, well, the industry comes back with restrictions. And we have this example now in Italy that if we can search a bit around Europe, we can see that this is common in every country. I'll talk more on this with my home country, Portugal, because we have several examples that show that due to science, we restricted and we banned certain types of foods, and that had a huge positive effects on the health of our citizens and mainly our children. And so, to talk about the farm to fork, this is a very important strategy that is being developed. Here we have a timeline, so I do think that the majority of who's listening knows what we are talking about. To give you a perception of how important this document is, the European Parliament has proposed 2,295 amendments, and this is a strategy that is being debated through the Agri and Envy Committee, because it has a lot of repercussions, not only on health, but also on environment and the way we produce food, and the way we should shift our way of eating in the European Union, and also so we can be a role model to other countries. We made several amendments. I think this is important to clear, because in this document we can clearly push the way that is science-based, and that shows us that we really need to shift the way we produce, we market, and we distribute food. So you can see several examples. Obviously, my colleagues can have other examples, so I'm just doing this for the purpose of showing how this works, because I think it's important for those who don't understand the process of making legislation to understand how it works. So on the left, we have amendments that are introduced that are new, so 2 examples. And on the right, we can see one example of one amendment that is being refined. So we already have a proposal, and on the right, we refine it, adding more words, shifting words, so trying to improve the text that it's already being shown and proposed. Here we also have several other amendments. So we focus on canteens, for example, so trying to add organic ingredients, more related to season, so they can be healthier, cooked by chefs. So a lot of focus on the way everyone at canteens eats. So to have this approach that better food has to be accessible also, and schools and universities and also hospitals are a huge part of this change. And for example, trying to reduce also the VAT on products that are more healthy, for example, fruits and vegetables, and trying to add some type of incentive to this type of foods to be accessible or more accessible to citizens. And we have several other examples, but this is showing just how we are proceeding on this type of document that is really relevant, and it should also influentiate the common agricultural policy. That let's see if it does, because the common agricultural policy is now on the phase of trilogue, so it's being debated, the final document between the Parliament, the Council, and the Commission. And these strategies, the Farm to Fork and the biodiversity strategy, are still on the Parliament's side. So we still have to see if they manage to enter and to influentiate the common agricultural policy. We wish they will, and we will also make the efforts so they will. For example, it was said by my colleague that she doesn't believe in ban. I don't know the specifics of the ban that she told that she promotes, but we can see through several examples that the restrictions and the ban of several products is also and always driven by science, obviously. It pushes customers and citizens to consume better products, or at least not having certain non-beneficial products accessible. And so we can see this at some stores. So it was stated here, the beverage, they are full of sugars, some are very sugary drinks. In Portugal, we had a huge problem because I'll show it in the next slide. We managed to make a national law, so this also occurs at national level, and so we had a tax on sugary drinks, but the drinks related to milk, dairy milk, and dairy products that had also high levels of sugar were removed from this law. So again, I go back to the beginning. That's obviously the industry has a huge power to influence policy decisions. And so I think this is also relevant for SMEs and other companies to try to assess what are the priorities in their markets, because there's a shift happening, especially here in Europe and European Union, and consumers want also that companies change, and so these shifts are very, very relevant. And so it was added that we had several taxes, namely on these drinks, and the consumption dropped a lot. And obviously, we also had this income to the tax from these taxes, and we could direct these taxes to what I think is common for everyone here, to make the education, to improve education, the support. The support that's obviously schools and other projects need. So we've channeled this revenue to incentivize programs to help citizens to consume better products. And I think also it was very relevant because Portugal was the first country to adopt a vegan option in the public canteen. So this is not mandatory, and I do not believe in the mandatory on this issue. So healthy food can be an option, and so it was proposed to all the canteens. We are talking about creches, we are talking about universities, schools, hospitals, prisons. So every public canteen could have a vegan option, obviously a nutritional good one. So this was very, very relevant. So we can also give options to citizens. And our public health minister made 2 manuals that clearly states that vegetarian, vegan lifestyles can be healthy. And so they had 2 guidelines, one for adults and one for children, that says, okay, if you want to have this lifestyle, good, but then you have the science behind it, and so you should be concerned about this, that, and so on and so forth. So this is also very important in a public sphere to have the health ministers helping and guiding citizens if they want to choose this type of nutrition or lifestyle. And I finish by saying, okay, it's very relevant to have awareness campaigns, obviously. So this is a common effort from SMEs, from public institutions, from teachers, from parents. I also have 2 daughters, so obviously I think this is a concern for every parent. And we should try to be as more scientific as we can, so we can push this legislation and improve the recommendations. So at the EU and national level, we can bring these policies to a good end. And I do think it's important also to reach out to policymakers and try to understand their position and try to make them understand, me included, obviously, the pros and cons of certain types of policy making. So we should not think that we have 100% sure of everything. That's why we should use science to guide us, and the data that we already have, that it's a lot. So thank you very much for this opportunity and for the debate. I'll stop sharing.
Thank you very much. I think this was a very good presentation, what is possible by the policymakers to tackle this. There was awareness, bans, taxations, and so on. I think it's interesting because we have also in Great Britain a sugar tax. We had in Denmark a fat tax who was failed. So there are different examples, but I think we have now, before we come to the debate, and I think it will be interesting because there are also different perspectives how to tackle it and how to intervene. Is there also an intervention by governments then how and how it should be? And I think we have now as next speaker for Professor Bisalski, who cannot come today because he has his vaccination appointment. I wish him good luck. But I think it fits exactly to this discussion now, Florencia Braga, Manager Scientific Affairs, Emma, Herbalife Nutrition. I think it's interesting because you are coming from the food sector, for the food industry. Perhaps you can add now your perspective from this level. Please, the floor is yours.
So first of all, thank you for the introduction. I will just share my screen. So give me 1 second. I will just use this couple of minutes to, well, apart from what you just mentioned, I would like to add a new player to this debate, which is the coexistence of obesity, but also with the lack of micronutrients intake. And as you can see here, well, globally, we are facing a major problem, a double-sided problem, because we have almost 2 billion people with overweight and obesity, but also around 2 billion people with who suffer lack of some essential macronutrients intake. This is well, quite a well-known issue, and actually known as the double burden of malnutrition, which is characterized by the coexistence of both undernutrition, including micronutrient deficiencies, and overnutrition in the sense of overweight and obesity, and also diet-related non-communicable diseases within individuals and within households and populations through the whole life course. The drivers or the roots of this double-sided issue are quite varied and include social and behavioral, environmental and biological factors. I'm going to describe them because, well, actually Christine Schneider, she described it perfectly at the beginning of her speech, and I absolutely concur with her. The only ones I would like to highlight here are the effects of the food supply and the food portion sizes. The fact that we are now, I mean, consumers are now faced with bigger portions and more accessible and palatable and convenient foods that are usually high, I mean, energy dense, but nutritionally poor. And this also has a very high interaction with the socioeconomic factor, because these kind of foods are usually more accessible. Just to show you an example of an exercise done a couple of years ago, actually, but this is a study done in the UK, which shows that the more healthy food is actually, on average, 3 times more expensive than what's considered less healthy food, and actually this gap it's increasing along the years. Although the price of both type of foods is increasing, the gap between them is increasing as well, which means that with the time, it seems that healthy food can be even less affordable. So the problem is getting bigger and bigger. And well, at the beginning, I mentioned this coexistence and of overweight and lack of micronutrients or lack of or insufficient intakes. And it might be obvious when we, I mean, compare these 2 factors between individuals or within populations, but they do also exist within people. So we have, I mean, the same person suffering from both overnutrition and undernutrition at the same time. There are some food and nutrition surveys showing that obese people, although consuming excess of energy, they are consuming less less micronutrients than what they need. And actually, what I'm showing here is an example of, this is not a food and a food intake survey, but it's a study on, well, pre-bariatric surgery patients, where they actually tested, blood samples and show how, how important these micronutrients deficiencies are within obese people. You can see the numbers here. The percentages of inadequacy are quite high in some micronutrients in particular. And actually, what this study has shown is that the higher the BMI, the higher the percentages of inadequacies. So this is an important issue that we need to pay attention to as well. I tend to describe this interaction between excess of nutrition and undernutrition as well as a negative cycle, because well, both of them share the same roots, as I mentioned before. It's a multi-causal root, but with focus on the increased consumption and availability of energy-dense and nutrient-poor foods. But also, some studies also show that, in terms of this negative cycle, the lack of micronutrients, the deficiencies of some micronutrients are also increasing the problem, because they enhanced the risk of some obesity-associated comorbidities. For instance, the case with vitamin D and diabetes. And also there are some other studies that indicate that the lack of some micronutrients might influence the function of some hunger modulatory hormones. Still too much to study on that, but there are some hints of that as well. And also nowadays we have a quite, unfortunately, we have a new player which is also influencing this negative cycle, which is the COVID-19 pandemic. And actually there are some studies showing already that the problems that this pandemic will cause on the double burden of malnutrition, apologies, is quite profound. And we, healthcare professionals are already seeing this within patients and population. And just to finalize this reflection, I want to also reflect on what the other speakers already mentioned. Because to tackle this double burden of malnutrition, we really need a more harmonic interaction between many stakeholders. We not only need to ask individuals and with their community support or healthcare professional support to improve their diets and lifestyles. We also need the action and the participation of policymakers, the academia as well, and the food industry as well. So the importance of this multi-stakeholder approach is, I think it's key. Thank you.
Thank you very much. If we stay with this last slide, this multi-stakeholder approach to tackle overweight and insufficient micronutrition. What is the role of the food industry there? What is your part in this interaction?
Yeah, so yeah, I concur with you. Some words are really hard to pronounce, but yeah, I think that the food industry, as you mentioned, has a very important role here as well. And as members of the food industry, what we need to guarantee to consumers is the availability of healthy, affordable, palatable, and convenient food, which is, you know, low in energy or moderate in energy, but rich in terms of nutrients content. And also we need to understand the importance of how we communicate the differences between different types of food to consumers, for them to understand what they are getting and what they are consuming. And of course, there's a key role from the industry with their own employees, you know, guaranteeing the access of healthy foods and a space for them to exercise and maintain a healthy lifestyle as well.
Thank you very much. I think this is very interesting. We heard now a lot where the problems are, how we have to work together. Different approaches belongs out education, advertising, tax bans, better products, better information. I want to go to the Professor Hasapidou. If you see now the problematic, how to tackle it, I would say also that these are not only, is this really always an education problem? Because as an example, I know these rules, I don't stick to it. And many other people who are in the same time also know it and don't need really an education. It is sometimes like everybody knows cigarettes are bad for your health, but they're smoking still. Is this, how you can describe this situation that it's not only always a lack of information? What are you thinking is the problematic there?
Yeah, that's why I paid attention, and all the other colleagues today, they did the same on the change of the environment. Okay, the change of the obesogenic environment. And we also, I think all of us, we try to describe that this is a multifactorial disease. And I want to stress the word disease, because we have to advocate that obesity is a disease and is an urgent and relevant health priority. And we have, all of us, we have to work together, because we do know, we all describe the solution. The importance, in my opinion, is to have it as a priority, especially to policymakers, because this is, in my opinion, the solution, to stress the importance for priority to all policymakers, and we all work together, all the stakeholders. Otherwise, it is very difficult to have a result.
Thank you very much. I think this is what you say, a disease. This is from this what we know from science. Is this clear? But we have also a discussion in our societies, body shaming, and also the last thing we saw on Cosmopolitan in Great Britain. This is Be Healthy, where they show overweight people who are happy with themselves. How we can address this to the people to say, be confident with yourself, but in the same time take care about yourself. Perhaps Ms. Braga, as industry, how you can handle these things that you want to help the people become more healthy, slim, or in shape, and at the same time not to give pressure to these people to feel them bad about themselves? Or is this what I think it's really a difficult approach? Ms. Braga, please.
Yeah, so I think it's a combination of factors, and the industry has a role in educating as well, as you already mentioned, because the key here is to highlight the importance of having a healthy weight rather than slim figure, which are really they're different things. Some people might get confused with these two concepts and think they are the same, but I think from our point of view, and from the industry, and also from the media as well, the social media, I think, plays a key role in sometimes making consumers a bit confused in terms of the differentiation between being slim and sometimes good looking and being healthy. And our role is to teach people to be healthy in an holistic way, I would say.
Thank you very much. I think this is a Solomonic answer. Ms. Bakugiani, if we see that this is a multi-level approach from global, local, and there's the European Commission between, where are the chances and limits of your support? What is this now that you reach out with your knowledge center to associations, to organizations like EASO, or how you can create a benefit that you can, like a multiplicator for this help to defend this or fight this disease? How you can interact with member states and the stakeholders, please?
Thank you for your question. First of all, as Professor Hasapido already mentioned, the first step is to understand the multiple nature of this disease. So like this, and this is why we're working on the research, on the various research projects on the topic, we can find also the domains of action in a way. All initiatives have a multi-sectorial approach of the topic, starting from school, even family, inviting parents or future parents to integrate in their lifestyle healthier nutritional habits or physical activity. At the same time, all our information is open, and we always invite citizens, stakeholders to be part of the projects, to be part of the information line, let's say, in order to form the policies that apply to everyone and can inform in the end more effective to everyone interventions. Thank you.
Thank you very much. If I can go to Francisco Ero back, because you mentioned a lot of possibility how the government policy can support these cases. I want to only be a little bit advocate diavolo. If you see this, you have mentioned some very strong tools like taxation. If I say taxation on food or ingredients or so on, if you see in the same time, it's also a social issue, that obesity is often with the weakest vulnerable groups in societies, where you see that people with higher incomes can pay easier these taxes, and less rich people not. Is this really a kind of education? Would you say it's not more an enforcement to these groups? How you would say this? How we can tackle this? That it has also a social approach in this tool, please.
Yes, of course, there's a social approach, and that's why we have been promoting that. For example, in the Common Agricultural Policy, we don't finance industries that are pollutant or that don't bring the necessary better nutrients to our society. So obviously, we should work with companies, we should work with farmers, we should work with public and private institutions, but we have to understand the costs that these pandemics, these health pandemics, have in our society. And so we have to channel the proper finance to the proper industries, and in the end, at least we have to let the market work in those areas that needs, for example, intensive production of animal farming. It has consequences to our health, it has consequences to the workers, it has consequences to the water supplies. It has several consequences in gas emissions, but in the end, we should not ban those type of productions. We should disincentivize as much as we can, and in the end, that will be reflected on the price. So if we have a common agriculture policy, for example, that helps farmers to build more extensively, more biological, to produce more locally, to be more in contact with the public canteens, to the institutions, to the local markets, to the big suppliers, and it can also direct their products to the industry so they can make better products. Well, we are financing a type of access to the citizens. In the end, that price will be lower, and we won't have, for example, a Coca-Cola that costs 70 cents and have a huge impact at several levels. So obviously, we are very concerned, and this has a very deep social concern to us, and that's why we should directly influence positively the policies that we make. So we cannot continue, for example, financing through the Common Agricultural Policy the campaigns, marketing campaigns that promotes the consumption of animal products. For example, in Portugal and Spain, that is called the beefitarians. So we don't know which type of beef that is being produced. We are simply saying to citizens, okay, in one hand, we should go more plant-based, and that's what the data and the science shows, that we should have the decrease of animal consumption. And in another way, public money is channeled through this sectorial incentive and marketing to the consumption of products that are not healthy, but in that way, consumers should make the final decision, but the public money shouldn't be directed to those types of industry. And just to finalize, I also would like to say that marketing, we have to be very careful, because to stop here, because of role models, and role models sometimes or most of the times are paid by big industries that, well, we don't have anything about big industries, but some of their products are not healthy as they should be, and then they are marketing with big personalities that should be really good, and well, that gives a different approach of role modeling that we should have. So we should be a bit skeptical about this perception of role modeling that is a solution, or one of the major solutions. I think public policy should be one of our priorities.
Yeah, thank you very much. I think the last point is very important, of course. Also now, because we have now this selling in the internet and so on, and I think this becoming also must be also very transparent for consumers and so on. I think this is an important point. I want to use now also the last 20 minutes to the second part. We spoke a lot about nutrition, but not about physical activity. And I think we know this all now with COVID-19. We are sitting at home, most of the time home office, and we want to extend now also the digital work and so on, but it means we stay more and more in front of screens. How we can tackle this? At the same time, many clubs and so on are closing, so the possibilities or the opportunities to have their something like a football club or so on, this is decreasing in some rural areas, so or city parts. And physical activity, what is the part of this, Professor Hasipaidou? What is this? What is the part? Is it only about nutrition? How, if you can give us a percentage, is physical activity 30%, 50%? What makes it? What is the part of this?
There were 2 points. I had raised my hand to include 2 points in our previous discussion, and then I'll go on about physical. Okay. One that we didn't mention, and I want to pay attention to that, is stigma, not to work on not stigmatizing obese individuals. And this is something it's mainly of what we discussed before. Yes, of course, obesity is a disease, but we have to be very careful not to stigmatize individuals with obesity. This is one point I wanted to raise. And the second one is a treatment. And then I will sort of combine that with your question, because when we're talking about treatment, we have to offer these people the right treatment. And that means we have to have all the facilities at all levels, at the community level, at the hospital level, etc., etc. And there we go to what we are talking about, physical activity, because we have a lot of discussion in different panels those days about what are we going to do with what you already described, the situation regarding COVID-19, and people do not go to they don't really, they reduce a lot, and we have a lot of studies showing that people have reduced a lot their physical activity, and this is something expected. So how we can prescribe, and let me use this word, physical activity, because this is something we're discussing about the treatment of obese individuals. How can we sort of increase their physical activity? Could we have a prescription for physical activity? And what would be this prescription? So generally speaking, our advice is 150 minutes at least per week. And this is something we have to insist on, because what we're saying now is that if it's 150 minutes per week, that means at least 30 minutes per day, not including weekends. And that means you have to go out and walk. And this is the very simple advice we all decided to give. So if we sort of say to people, look, every day you have to go out with your children, if possible, and walk. This is a very good, let's say, first level, if I could call it that, advice. Of course, there are people that they follow, they sort of find ways doing, for example, increased physical activity through using programs through internet, like yoga and like aerobics. So there are people that they say that they even became more active because they had more time. So it is this category, but we're not mostly talking about them. We're talking about the people that they don't go out, and especially overweight and obese individuals, that they became worse in terms of physical activity. So we have to sort of push forward this message, go out and walk. That's my first level answer.
This is, I think, the simple answers. Walk is the best, because everybody can do this immediately. I think if you make it complicated, you have to plan it 3 weeks to subscribe you to a club and so on, and then you're starting perhaps. Yeah, but I would come also back to Ms. Braga. In fact, the food industry, the role of physical activities. If I made also Weight Watchers before and so on, it says one cookie you have to run 30 minutes or whatever. Would it be also clever to have it on your products that you say, if you eat this, you have to make sports for 2 hours to compensate it?
Well, it's a good question, because we in all our educational sessions and different training materials, we always say that you cannot over-exercise bad nutrition. So you have to do both, try and keep a good nutrition and also exercise. So at least in the company I work for, there are several initiatives, not only towards consumers, but also towards employees. Some initiatives that we try and follow are, from time to time, take a break, do some stretching, some exercise. We are also promoting sharing exercise tips within colleagues, and also when possible, try and exercise while taking calls. In these days where people spend lots of time, Zoom calls, etc., etc. Well, in those ones where possible, also try and exercise at home, or as the professor just said, go out and walk. I mean, if possible, and if you have a safe place to do it, try and take this call while walking as well. But also, in terms of consumers, as mentioned before, we have a key message, and for us, education is key, and the role, we always emphasize the role of physical activity, from the very basic as go out and walk till different type of recommendations in terms of physical activity. We do agree with the 150 minutes per week, but we also tell people do it whenever you can. Even if you can just do, 10 small blocks of 10 minutes per day, I mean, every several hours, then, do that as well. Yeah, I don't know if that answered your question.
Yes, thank you. I think this would be a part, in fact, is a practical advice, but I think it's like also a corporate social responsibility. If you selling food, that you also show people how to have a healthy lifestyle, how to be active. Perhaps this is also a way, perhaps, that the industry becomes more active to avoid bans and taxations, also that taking more responsibilities. Mr. Francisco Guerrero, is our lifestyle not also very much related with this obesity? I think we have stress, we have working balance is very often mentioned, that the people have also this financial pressure now in these times, that this leads also, there are so many studies, if you don't sleep very well, that you have the tendency to get more weight and so on. Is this also something what we have to tackle, to say it is not only about food, it's not only about sports, it's also how happy, how good we can live our life?
Yeah, you said it all. I think we now live in a society that, well, the data shows we never produce so much wealth and so many goods as we produce today, and yet we have less time to spend with our families, to spend to ourselves, and to enjoy life, and to try to understand why we are here. That's the biggest philosophical question that we all have. And this correlates, if you are the left, the right, if you don't have an ideology, we all are here to understand what is our life, and what are our goals, what makes us happy. And in the end, we have to restructure our society, and we have to work less hours. So the 40-hour journey that we have, at least in Europe, it's also outdated. So we have to reduce the working hours. We have to maintain the level of salaries. Companies should be incentivized also to have telework, to help citizens to pass more time, not obviously in a pandemic way, but at general, when we start to come back to the normal life, to have more time for themselves, to bet on workers, and also on the companies to have better systems that can support the community, because if we have good workers, the company also thrives. And in the end, I think we really should be talking, and this is parallel but is correlated to what you are saying. We need to start testing in several countries the basic income, so that we can have a structural change at our economic, social, and financial system, so people and companies could have more liberty, and they could live better lives, and so they can care more for their children, for their health, and for their community. So the basic income is a program that is being tested all around the world, and I think also SMEs would be very, very happy with the results, because we have better workers, we have better job opportunities, and in the end, we all live a better life.
Thank you very much. I think this is a good target. I think for this, I want only to mention, as a lobbyist for SMEs, we have in this context also to fight bureaucracy, because many SMEs owners are working on Sundays to do their documents and so on, and this is also driving them apart from the family. And we have, if we want to have the targets in the discussion, employees are of course the key. Without employees we cannot work. Often we forgetting the little micro business owners and also bigger owners, how often they are overworking, and I think I would be not surprised. From my experience, you have always two types of entrepreneurs: the super sportive or the super strong person. So there are two extremes who are coming out, how to handle stress and pressure and your social life. To the end, before we come into a short summarizing of everybody who gives a conclusion, I want to come to innovation and science. Professor Hasipidu, could this be, as you see sometimes in science fiction movies, we eating what we want and we don't become fat. Can this be a future, what is also a solution, that we find new methods of nutrition and so on, that we stay, or it will be only a dream of mankind, and perhaps it's also not such a good idea if some people have not enough food, that you will have technologies only to eat what you want. Please, is there something in the pipeline?
Well, this is a magic pill we are looking for all these years, and we haven't found it, and I don't believe we will find it. But it's definitely that we have improvement in science and in the scientific achievements, like the omics technology. We have a lot of new developments regarding genetics. And for example, looking at the microbiota, we have more detailed results on that. And we do know that our microbiota is affecting our nutrition. We do know that our genetics, of course, are affecting our nutrition, and we're looking forward to these developments. For example, we do know that we can have a more personalized nutrition. And I can give you an example. If you do have a sort of finding from your genes, from your genetic profile, probably it could be very well related to one of your nutrition, related to your nutrition intake, specific nutrients, that if we know that the problem is there, we could help you, in probably reducing body weight. But that's where we are. Unfortunately, I don't think we're going to have, as I told you, the magic pill in the next years, but definitely we're looking forward to the new achievements and scientific developments, and they helped us a lot. And we have a lot of progress regarding the way we are treating, for example, obesity, compared to what we used to do years ago.
Thank you very much. Ms. Braga, do we have expecting something from the industry to solve this, or is this only because you have so many pills and so on who makes you slim and so on? What is realistic there?
Yeah, I would say I agree with Professor Haspiatu. Apology for my pronunciation. Yeah, I don't think there is a magic pill. There are lots of things that might help. And the key is to produce healthy foods that are palatable and accessible, and also accompany these healthy foods with proper education and with a personal approach. So whenever possible, companies should encourage community support or people to take a personalized approach to their diets, and to have a balanced diet between including as you just said, foods that they just want to eat, but also the foods and the nutrients that our body needs.
Thank you very much. And I think we come now to our last round, to the last statement. And I want to start with the easy questions. And for your statement, Ms. Pacogiani, what is the knowledge gateway also doing beside obesity? Because I think this is not so well known to everybody here.
Thank you very much. And I'm happy that you are doing this question, as it might bring also some answers to all the topics that you asked before, as the Health Promotion and Disease Prevention Knowledge Gateway includes topics that are related to nutrition, physical activity, with many and various policies that apply to the whole society, from school, work level, and even changes in the infrastructure of cities that are promoted now in many countries. And then the prevention of non-communicable diseases, but also we are now moving, and we will publish soon, some briefs, some chapters, let's say, on mental health, which is also the COVID pandemic. It became even more obvious how important it is to not forget mental health together with physical health. So these are the topics that are covered and are gonna be covered in the future, and they come, as said before, as the priorities defined by European stakeholders, let's say. So it comes to cover the needs of stakeholders in terms of information, We try to keep them as much up to date as possible. It's a living object, let's say. And now that we are also in the Knowledge for Policy platform, it becomes even more interactive to have suggestions for documents and publications to include.
Thank you very much. I will go to Professor Hasipoulou. What we can expect from EASO the next time?
The aim of EASO for the following years is to support the development of a unified evidence-based approach to tackle obesity. And we want to do it across disciplines and across countries. We want to coordinate the messages, to connect stakeholders, and to create the opportunities for collaboration. Thank
you very much. And Ms. Braga, yes, now your conclusion about what you learned here from our webinar.
Well, I think the key here is the cross collaboration within the industry, policymakers, healthcare professionals, community, and the academia as well.
Thank you very much. And now the political summarizing, and I think always we're expecting solutions. Please, the floor is yours, Mr. Guerrero.
Well, the first, I would enjoy that my other colleagues could also be here to learn with my fellow speakers, because I do think that it's very relevant for us, even if we don't agree, to listen to everyone as much as we can. So I think that would be my non-friendly comments to my colleagues, but friendly comments to other speakers. And so now in a more serious note, I do think that we should look at the data, look at the science, and understanding that this is a really serious question, a really serious issue that has to be debated also with the industry, and especially, and this is very, very important to me because I come from Portugal, and most of the enterprises that we have are SMEs, so we have to talk to SMEs, and we have to try to channel the proper means so they can also work at their level to produce better food, to have better labeling, to distribute better the food, and also to have profit, because we are not against profit, but we should facilitate as much as we can all these actors and try to gather the scientific data so we can all reach the more perfect equation with all these variables, so we can have a more fruitful life. Because in the end, as the moderator said, and I do think that is the main issue, we should live our life healthier, and we should pursue our dreams and not being tackled with issues that should not be an issue.
Thank you very much. This was, I think, a very good closing. I think also, yes, democracy is also about to fight for the different points, opinions. I think we can only grow with it, that we listen to each other. And I want to invite you to our initiative, Healthy Lifestyle at Work and Home. It is directly founded or created by SME associations who want to reach out to the SMEs to help them to raise awareness. And I think this is a good cause. And if you want to join it, please contact us. We would be happy, and we're creating this now for Germany, also specific for Austria and other countries. And if you want to be on board, please contact us. We are happy about every support. Thank you. Have a nice day. Thank you that you were here. I think it was really a fruitful debate. Thank you very much.